Hello everyone, this is your very own senior helping you to cram all the important topics just before your final profs. Let's start with the cerebellum first. This is most likely to be asked in any of your final profs. Having said that, in case if you have just 1 hour to study physio, you should definitely do this. Let's now briefly study about functional division of the cerebellum, functions and its disorders. There are mainly 3 functional divisions. The central part, which you can see here, is the vermis. The one lateral to the vermis is the spinocerebellum, which is in the intermediate zone. Lateralmost is the cerebrocerebellar, which is in the lateral zone. And finally, this is a flocculonodular lobe, which is also a vestibulocerebellar. Now let's look at the function of the individual areas. The spinocerebellum helps in alternate fast movements, coordination between the muscle groups, precise, smooth, well-coordinated movements. Next, cerebrocerebellum. It helps in the sequencing of the muscle contraction, whereas vestibulocerebellar helps in posture, equilibrium, eye movements in response to the head movements, that is the nystagmus. Now, coming to the test which we usually perform to see if there is any abnormalities. Firstly, in the upper limb, we have 2 tests, that is finger-nose test, finger-to-finger test. In finger-nose test, here you touch your nose with your finger. In finger-to-finger test, you need to touch 2 fingers of your opposite hand. Now, coming to the lower limb. We have 3 tests here, knee heel test, Romberg test, tandem walking test. In knee heel test, take your heel and slide it against your opposite knee. Romberg test, this might be your another question, so listen carefully. It is mainly to differentiate sensory ataxia from cerebellar ataxia. Here, the patient is asked to open his eyes first and then close while he is standing. If the patient has nystagmus only when the eyes are closed, then it is sensory ataxia. If present both, that is when the eyes are open as well as closed, then it is cerebellar ataxia. Last one is a tandem walking test. Now let's see the disease related to the cerebellum. Firstly, ataxia, which is incoordinate movements. It's due to the defect in the control of the range, direction, rate and timing of the movements, dysmetria and the pass pointing. Inability to control the range or the extent of the movement, which means when the patient tries to touch some objects, the hand overshoots. Dysdiadodykinesia, that is inability to perform rapid alternate opposite movements, that is rapid supination and pronation of the arm. Drunken gait. I don't think this needs any explanation. Having said that, here the patient walks on a broad base. Slurred speech, intentional tremors. What this means is that it is absent at rest and appears when the patient performs some voluntary activities. Rebound phenomena. Here the patient cannot stop a movement abruptly. Nystagmus. As you know already, here we perform a Romberg test. The last one is hypotonia, which means the loss of tone of the muscle. That's all for today. Thank you so much. In case if you like this video, please do like, comment and share with your friends. For any other topic recommendation, please comment below. See you all again super soon. Thank you again.